You've probably heard the term Ozempic Face floating around. It's totally gone viral, describing this very specific look that's become a huge topic of conversation, both online and in doctors' offices. But is this all just about looks, or is there a much, much bigger story playing out here? Well, let's dive in and see what's really going on.
I mean, just look at this. Since early 2023, the interest in Ozempic Face hasn't just grown, it has absolutely exploded. This thing has gone from some niche internet buzzword to a full-blown mainstream concern. So today, we're going to pull back the curtain on this new class of revolutionary drugs and find out what's really happening.
So what are people even talking about when they say Ozempic Face? Well, in a nutshell, it's this gaunt, kind of aged appearance some people get. We're talking about hollowed-out cheeks, sunken eyes, and wrinkles that seem more pronounced. And it's all tied to the loss of facial fat that can happen when you lose a lot of weight really fast. And look, this isn't some small, isolated issue. We're talking about an estimated 13% of adults in the United States who have used one of these medications. That's more than 30 million people. It really just highlights how widespread these drugs have become and exactly why their side effects are such a hot topic right now.
Okay, so to really get a grip on how these drugs affect the skin, we first have to understand how they work inside the body. What's the actual science that's making the weight loss happen?
The official fancy name for this class of drugs is GLP-1 receptor agonists, but at their core, all they do is mimic a hormone that our bodies already make naturally in the gut whenever we eat. This hormone, GLP-1, is a major player in managing our appetite and our blood sugar.
And the way they work is pretty fascinating. It's like a four-pronged attack on your appetite and blood sugar. First, they help control blood sugar by boosting insulin and blocking glucagon. But the real magic for weight loss comes from points 3 and 4. They literally slow down how fast your stomach empties, which keeps you feeling full for way longer. And on top of that, they work directly on your brain to dial down your appetite. It's an incredibly powerful combination.
All right, so with that science lesson out of the way, let's get back to the skin. Because honestly, this story is so much more complex than just a gaunt-looking face. We've got to look at both the unwanted side effects and, believe it or not, some surprisingly positive ones too. First things first, let's tackle the side effects that have been grabbing all the headlines and causing so much concern for patients.
So Ozempic Face is obviously the most famous one, but it's really just one piece of a much larger puzzle. Some patients also deal with a type of hair loss called telogen effluvium, which is often kicked off by the physical stress of losing weight quickly. Then you've got injection site reactions, redness, swelling, that can affect up to 20% of people. And some even report weird skin sensations, like tingling or burning.
So how common is this stuff really? Well, about 6% of all adverse events reported to the FDA for these drugs are skin-related. Now, that might not sound like a huge number, but you have to remember, experts think this is probably an underestimation, because these kinds of side effects often go unreported.
So with all of that said, you're probably thinking these drugs are just plain bad news for your skin. But is that the whole story?
Not even close. In what is a really fascinating twist, researchers are now discovering that these very same drugs might actually be used to treat several serious skin conditions. And what they're finding is pretty remarkable. For patients with diabetes, these drugs can actually speed up wound healing. They've also been shown to improve psoriasis, and here's the key part. The improvement seems to be from a direct anti-inflammatory effect of the drug itself, not just a side effect of losing weight. And they might even help with other inflammatory conditions like hidradenitis suppurativa.
So, given all these cosmetic concerns, how is the medical world responding? Well, not surprisingly, a whole field of treatments is popping up to deal with them.
The options really fall into two main buckets. On the non-surgical side, doctors can use things like dermal fillers or fat transfers to bring back that lost volume and use lasers to tighten up the skin. And for more significant sagging, there are always the surgical options, like a facelift or a neck lift.
Now, one of the cooler, more advanced techniques being used is called endotishal bipolar radiofrequency. I know, it's a mouthful, but the idea is actually super clever. One electrode goes just under the skin while another stays on the surface. This lets them deliver controlled heat deep down, which kickstarts your body's collagen production and tightens everything from the inside out. It's like precisely shrinking the scaffolding right under your skin.
And does it actually work? Well, a study of 24 patients who had this done shows some really promising results.
The vast majority of them, 17 out of the 24, said they were highly satisfied with how it turned out. So yeah, it seems to be a pretty effective tool for fighting these aesthetic changes.
Okay, so let's zoom out for a second. We've talked a lot about skin, both the good and the bad. But what about the bigger clinical picture when you're using these incredibly powerful medications?
This is a huge one. Remember that stomach slowing effect we talked about earlier? Delayed gastric emptying? Well, that's not just a weight loss trick. It is a major, major concern for anesthesiologists because it seriously increases the risk of a patient breathing food into their lungs during surgery. And that risk is so serious that the American Society of Anesthesiologists has issued specific guidelines for it. They're telling doctors to evaluate every patient's risk and to think about holding the medication for up to a week before a procedure. In some cases, if a patient has GI symptoms, the surgery might even have to be postponed. And finally, it is absolutely vital to know who shouldn't take these drugs, period. Because of a potential risk of a very specific kind of thyroid cancer that was found in early studies, these drugs are a no-go for anyone with a personal or family history of medullary thyroid carcinoma or a related condition called MEN2.
And this quote really just sums the whole thing up perfectly. The whole conversation around Ozempic Face has forced a really critical issue into the spotlight. It just goes to show how important it is for doctors to talk to their patients about the full range of effects, both the amazing benefits and the unintended side effects, so people can make truly informed decisions.
And that leaves us with the big, lingering question, doesn't it? These drugs offer absolutely revolutionary benefits for metabolic health, no doubt about it. But they also come with side effects that can really impact a person's quality of life and how they see themselves. Figuring out how to balance those two sides, that is the central challenge we're all going to face as this new era of medicine unfolds.